Welcome to the last video in this series on health literacy. Today, I will be providing a general overview on different types of insurance. First, we have private insurance. These are private organizations like Aetna, United Healthcare, and Blue Cross Blue Shield. This is usually offered by an employer, and the cost is taken out of the employee's paycheck. Private insurance can cover the employee and any dependents, such as a spouse and/or a child or children. These plans are separated into two different options, depending on what your employer chooses. You can have an HMO or a PPO. These will be described later. Private insurance typically covers most medical necessities, like seeing a primary care provider, a specialist, or a hospital visit. You can also find out what you're covered for on your insurance company's website. Some private plans can also be purchased on your own without an employer. Medicare is insurance that can be purchased through the government or through a private company. This is not dependent on your income. It is for those who are 65 years and up, and for those who are on disability. Private companies that offer Medicare offer a Medicare Advantage plan. They typically offer a bundle of Parts A, B, and D. This can help cover hospitalization, other services like primary care providers, and equipment needs. And it helps cover medications at the pharmacy. Medicare Advantage plans can also have the HMO or PPO options due to being provided by a private company. Medicaid is insurance that can be purchased through the government. It is dependent on income for those who live significantly below the poverty line. Medicaid covers individuals and families. To qualify, an individual and family must meet state and federal guidelines. This insurance can help provide coverage for preventative care for adults and children. An HMO is a health maintenance organization. It is designed to focus on preventative care, and the individual and dependents are required to have a primary care physician. The primary care physician will organize all care and provide referrals to specialists if needed. The idea is that all care is organized by one person and can focus on maintaining health. This type of organization can have a lower monthly cost and lower copays at time of service. However, if you wanted to go to a provider outside of your network, it will not be covered unless it is a medical emergency. A PPO is a preferred provider organization. It allows you and dependents to see any provider that is within the network. This includes seeing specialists without a referral. There is no requirement to have a primary care physician to organize care, and if you choose to see a healthcare provider outside of your network, the visit may still be covered. There is a chance for higher fees or that you pay the full cost upfront and get reimbursed for the payment by the insurance company. This option can have a higher monthly cost to you and a higher copay at time of service than an HMO. Some prefer to have the option to see more providers and to not need a referral. Some general terms associated with insurance are listed on the screen. A copay is the price that is paid at the time of service for some services. This can include an annual office visit or an office visit to a specialist. Most plans also have a deductible. Depending on the insurance plan, this can be a small amount like $2,000 or a higher amount such as $5,000. The costs that go into your deductible are bills for being in the hospital, surgery, lab tests, and MRIs or CAT scans. Typically, the copay does not count towards the deductible. Once the deductible is met, there is co-insurance. This means that the insurance company is now paying a portion of services provided. It can be an 80-20 split, meaning the insurance company pays for 80% of the cost, and the remaining 20% is for you to pay. To help find out what your insurance covers, you can go to the insurance company website. A list of links will be provided in the description of the video. Once on the website, if you have not registered for an account before, make an account. This is easy to do. All you need is your member ID or Medicare ID, your full name and date of birth. Some sites may also ask for your social security number, but not all. Choose a username and password, and now you have access to your coverage. On your account page, look for a tab or button that says Coverage and Benefits, What's Covered, or My Coverage. This will take you to a page that identifies what is covered by your plan and if you need a primary care physician or a referral to see a specialist. On your account, you can also look for a provider in your area that accepts your insurance plan. This will save you time from calling multiple doctors to see if you are covered. These are some examples of different cards, and circled are the member ID or Medicare ID numbers. In the yellow box is the cost of the copay at the time of service. Thank you for watching the videos in this series. The videos will remain on YouTube, so you can always refer back to them if needed. Please remember to leave any questions or comments below the video.